Right. So, thank you and welcome to this Hazards Campaign Thursday talk. My name's Janet Newsham, for those that don't know me, and I'm the chair of the Hazards Campaign. If you can make sure you're on mute unless you're called to speak, that'd be brilliant. It'll just stop any distractions of the speakers. And we've got some fantastic speakers tonight. So tonight's talk is stopping the abuse faced by call and contact centre workers. But I mean, one of the questions we should be asking really is what is the definition of that? Because there's a lot more workers now probably falling into this category as more work goes online. More people have become call and contact centre workers, and they're working in all sorts of strange working conditions. Pre-pandemic, we heard in the Hazards campaign of call centre workers having to hold up cards to go to the toilet, or holding up red cards if they were on the periods so they could have longer time to go to the toilet. And terrible abuse of workers' rights. And then time toilet breaks, and if you went over a certain time during the week, then you were disciplined and eventually you were dismissed for going to the toilet. So some horrendous conditions that workers in call centres have been facing. And they're also facing verbal abuse, threats, people in despair on the other end of the phone and how they deal with that. But then also the abuse from the management in terms of the working conditions. And during the pandemic, lots of their working conditions have deteriorated and placing them at risk and subjecting them to unsafe and unhealthy working conditions, which we'll hear about in a minute. As I said before, we've got 3 speakers lined up for you who are each going to make a contribution, and then we'll have a general discussion and debate at the end. So tonight I'm delighted to introduce our speakers. We've got Professor Phil Taylor from Strathclyde University, an activist in the Hazards campaign and a champion of workers' health and safety and general rights at work. And he's going to be talking about his research that he's done with call centre workers in particular. Tracy Edwards, who's a fantastic comrade for the PCS. She's National Health and Safety Officer for PCS, and throughout the pandemic has been supporting her members tirelessly and holding weekly meetings of health and safety reps and holding their employers to account to keep her members safe and healthy. And our first speaker I'm delighted to introduce is Lesley-Anne Ure, who's a senior field organiser with the CWU, and is going to be giving a bit of background to the call centre collective and talking a bit about what the work she's doing in CWU and the STUC. And we're really pleased to welcome you tonight. So the floor is yours, Lesley-Anne, and start with you. Thank you.
Thanks, Janet. Hello and good evening, everyone. As Janet said, my name is Lesley-Anne Ure, working as Senior Field Organiser in the Telecoms and Financial Services Department of CWU. And this evening, though, I'm representing a campaign team we're part of named Call Centre Collective. Just to give you as brief a background as I can of Call Centre Collective, the team is made up of representatives from CWU, STUC Better Than Zero campaign, PCS and Strathclyde University. A couple of my colleagues are here tonight as well, focusing mainly on non-recognised call centres. Still in our infancy, and we're always hoping that other unions in Scotland join the group that we've got. Call Centre Collective was a confluence of several things that were taking place at the beginning of the pandemic. They needed a coordinated effort to ensure that workers' voices were heard. At the time, for example, CWU was already organising several contact centres. The STUC had launched a COVID working group, and research was taking place conducted by my friend and colleague Phil Taylor. So there was a lot going on behalf of workers, but not so much that directly involved those workers and ultimately looked to organise them under the pandemic. So Call Centre Collective came about as a common sense response to the serious situation, health and safety situation faced by key workers who were still in contact centres, and the need for those workers to be part of the solution. For clarity though, we only operate in Scotland because of the devolved government and the fact we have a bit of influence over the Scottish Government through the COVID working group. We started from scratch at the beginning with nothing except a diary date, a Zoom link and some willing people. And we've worked very hard over the past 10 months to get to where we've got. Organising workers in contact centres has always been challenging, not telling anything new to MD on the call tonight, but you all know that lockdown hampered things even further. It's been even more difficult. But, you know, we did the basics. We set up social media accounts, continually build a database of contacts, delivering webinars, workshops, we've ran petitions, gathered all sorts of information on what the priorities of workers are and are now becoming as a result of lockdown and the pandemic. But I suppose the most recent activity has generated the most attention we've had so far. And if I may, I'd like to tell you just a little bit about that. And I feel it's a bits and pieces about our plans going forward. We were working with some union members in a call centre company, an outsourced contact centre company called Teleperformance. This is one of the biggest contact centre companies in the world, about over 300,000 people globally. They employ not such a big footprint in the UK, but enough of a footprint to attract our attention. And those workers use an issue which we thought was appalling, quite frankly. And I'm going to ask you to bear in mind that everything I'm about to tell you all happened within the space of a week. So if I miss anything out when I'm telling this, relating this tale, I'm sure Phil will help me out if I forget anything that was fundamental. But Teleperformance had announced to staff that they would be distributing webcams to all of them, and that the use of these webcams was mandatory and was being rolled out in the main to enforce a clean desk policy. Now you might be thinking right now, well, we're using webcams, so what's the problem? Well, the issue was two parts of the issue. There was fundamentally that these were hardware that could be controlled remotely by team leaders and managers, and the webcams were panoramic, so would give the employer a wide-angle view into the worker's home. In terms of problems that would then raise for workers, and to name just a few, we're looking at, well, it was a complete invasion of privacy into the homes of these workers, the home not being a rent-free extension of the workplace. There's no guarantee of the integrity of managers controlling the cameras. The result could be severe anxiety and distress for workers, no consideration of any sort of mental health impact that might be happening. It was unnecessary, as the staff had been working from home for months during lockdown without these cameras, and these cameras were in addition to the already overbearing monitoring measures that call centre workers have to endure. And ultimately this was surveillance, not performance monitoring, and there'd been a massive difference between the two. Working with the members, we exposed the issue in the press and built an attraction created by the newspaper article. We took a deliberate decision to actually use the article rather than us exposing the issue, because the press would give us more traction. There was an almost immediate response from the employer to its staff, however, whereby Teleperformance reworded their announcement to make it sound like the cameras weren't as bad as they appeared. But we kept the pressure on, and our members kept the pressure on as well. Bear in mind as well that Teleperformance are particularly ruthless when it comes to targeting staff, and there are no agreements with Teleperformance as a non-recognised workplace with low density of membership, and any activists we've ever had, you know, get pressured or targeted and can be managed out of the business. We kept the pressure on them through our social media channels and press contacts, and within a week, because of this pressure, they amended the policy, and it was a little victory for those workers who were utterly buzzing, delighted with the result, but it's on paper, so we've won that battle and not the war so far with Teleperformance, I would say. And Teleperformance has more plans for their workers. They're not going to be curbed by a small social media campaign that Call Centre Collective have ran. They've changed their software now, Teleperformance, so that workers who are taking calls on certain contracts to take calls, they no longer receive an audio indication that the call is coming in. So this means that those workers have to watch their screen to know that a call is coming in, and it means constantly watching the screen so that they answer the call in time, but being at their desk to the nth degree, which, as you know, can cause vision problems, musculoskeletal problems, and potentially more cases of stress. we're in the process of investigating this issue. We've only just started talking to our members about this, so but I can guarantee you we'll be acting on that also, and we'll certainly we'll update hazards if there's anything to tell them about that. So watch this space. Briefly, in terms of other health and safety issues, the call centre collective has been looking at. We want to start to prepare workers to go back into the workplace in many ways. So we're running a risk assessment checklist, not a risk assessment, but a simple checklist for workers to use in workplaces without recognition agreements, so they can examine the quality of the risk assessment their employer conducts, and a working from home checklist that does the same along the same lines. The reason being that we don't necessarily, those workers are sometimes not members of the unions, we're bringing them into unions, and they've had no health and safety training. So something simple but effective that we want to supply them with, so that they have a say, an understanding, and the ability to raise some issues about the health and safety processes and measures that employers are taking. I suppose just to finish up, ultimately what I'm saying is that the employer, and probably many more, this employer is capitalising on lockdown and the pandemic to create a home-based workforce that is isolated and monitored in ways that have never been so extreme. And these workers have already been enduring some of the conditions that Janet mentioned at the beginning of the talk. And now, let's say, the development of a home-based workforce will bring a whole new raft of health and safety issues that we need to prepare for, organise and challenge, because they're extreme, very extreme. Thanks, Janet.
Thank you so much. That was really interesting. And I'm really interested in the checklist that you're talking about, because we've done a couple of checklists with, did one with Unison for care workers, but also on with Bakers Union for fast food workers, to look at how we could bring other people into challenging and helping and supporting workers in those workplaces, because most of us have got relatives, and a lot of us have got relatives in care homes. So a large unorganised workforce, but also, you know, young people in people in fast food sector who are largely unorganised as well. So how we could sort of support those two and provide, you know, well, I mean, what we did was look at a health and safety checklist that people could sit at the table and actually go through, and then start asking questions about the health and safety, and, you know, similar sort of thing to what you're doing, which I think is really
that's
useful.
exactly what it's for, Janet. It's certainly not to undermine health and safety reps or real risk assessment. It's so people are conversant on these things, and able when they look at them to understand or say, what that's missing, and maybe haven't thought of that. And it's a step towards potentially developing some people into health and safety reps, hopefully, but it's a little bit of a slower start for people, because it can be quite a big leap, can't it? So
yeah, absolutely. I think that's really interesting, and I, you know, absolutely agree about this. New challenges for home-based workers is going to be a massive challenge for the whole of the trade union movement, you know, in all our different sectors and all the different trade unions. So thanks so much for that, Lesley, and we'll come back to a lot of the points that you raised then. So our next speaker is Tracy Edwards, who I've said before is a good friend, good colleague, comrade in PCS, and she's going to talk about some of the work that she's been doing, and, you know, the things that have happened in PCS and their call centre workers. So over to you, Tracy.
Thanks very much, Janet, and thanks to the Hazards Campaign for organising this meeting. Just to say as well, always my appreciation of the Hazards Campaign. They've been absolutely invaluable throughout the whole of this year, putting on fantastic seminars that I can speak on behalf of PCS health and safety reps. Have got a lot of value out of them, and I'm really pleased to speak at this meeting tonight. However, I would point out that I think Phil and Lesley have probably got more insight into kind of the current conditions and in particular contact centres out in the private sector, because in PCS, a union that I represent, we are the UK civil service, so we've kind of benefited over the years from having quite, when we've had areas that have been kind of turned into contact centres, such as in the HMRC and DWP, for example, we have had, to a certain extent, quite well unionised workplaces, so therefore we've been able to strike quite good agreements over the years. We've struck some really good agreements in the HMRC, for example. But like everything else, however, these things are always being chipped away at by management. So the issues that facing contact centre workers in the civil service are very similar to those that are being faced to workers outside. However, the depth of it. I mean, the worst example I can think of was there was a big contact centre in South Wales where they were asking people to take a tennis ball into the toilet, and then once they came back, put it in, and if the bowl was empty, you couldn't go to the toilet. But thank God we had a well organised union branch in there, and we managed to get rid of that. And I'm sure people like Mandy's nodding their head and all that. I'm sure she's probably got examples of where we've pushed management back on ridiculous things, but that's always going to be the case when you work in a contact centre, isn't it? Just the nature of it. You're always going to have that pushback from management. They're always trying to squeeze more out of you, and we're obviously we're in a period now where everything's about productivity. So I just wanted to make some general points about I think that the call centre collective initiative in Scotland is a fantastic initiative, and I think I wouldn't worry about whether you're in terms of the checklist and everything else that's done. In my view, would be anything that helps the cause, because we're dealing with a whole swathe of young workers out there who are in non-unionised workplaces, and sometimes as well, the official unions might not have the resources, to perhaps reach to so anything that reaches out to non-unionised workers, the more the merrier, and we should be having the kind of the spirit that we're all working together to try and achieve the same thing, which is about improving the situation for contact centre workers. Now, Phil's going to talk about obviously the really important research that's been conducted over the past year, and I think that's going to be obviously an evolving piece of work. There's a really important exercise to be learnt from that, understanding what's going on, and in terms of us as the trade unions, in terms of how we develop policy on that, and that's going to be really important going forward in terms of what types of models of hybrid working. We know that home working can work, etc., etc. But fundamentally, when it comes down to the question of how do we fight against the abuse of contact centre workers, that you can have as many policies as you like in place, and sometimes those can be helpful, but what we have to address as well is the question of staffing levels, the question of quality of work, the fact that staff are having to undergo a horrendous sort of even before the pandemic. They're now the target driven culture, and just one little example I will give is about the DVLE in Swansea, where there's it's an example where all the issues have been brought to the fore, really, like many workplaces, where the highest concentration of coronavirus outbreaks in one particular employer in the UK has been recorded there. And the centre of that outbreak was in the contact centre. So not only was that problematic, but then once you delve into underneath the surface, you find out that those contact centre workers there have got the highest trigger absence, in terms of compared to the rest of the department. They're an agency, the Department for Transport, but as an agency, they've got the highest trigger point, so you get penalised when you're off sick. And they've got the highest targets and the highest sickness absence levels. So there's ongoing issues there, but thankfully the members at DVLA Swansea are fighting back on all of that. So I just wanted to just to sort of I didn't want to go on for too long. I think in terms of the point that I wanted to make, the main point that I wanted to make is that now is the time. I think everybody's had enough of everybody's been under the kind of mental torture that is how the Tory Britain is dealing with a pandemic. I think there's lots of examples of where workers are taking action, including the DVLA Swansea, and obviously in other areas, the workers are taking matters into their own hands, and it's got to come down to this one fact that we've got to be unionised. You know, we've got to you know, think of how we can how we can support those efforts. And I think something like the call centre collective is a fantastic initiative that, you know, we should try and expand to the rest of the UK. But anyway, I'll shut up now and want to hear more from Phil, and also interested to hear what people have got to say in the discussion as well. So hopefully that was useful.
It was brilliant. Thank you so much, Tracy. And you know, and I absolutely echo the call centre collective is a fantastic initiative. But you know, without the trade unions doing the work sort of work that you've done, you know, we do know that in normal times people are twice as safe in workplaces where there's an active and organised trade union, and certainly through the pandemic, people's lives have been saved absolutely as a result of that. I mean, we know that in the DVLA, where somebody's lost their life as a result of the pandemic and a result of the way that the employer has behaved in that situation, there's lots, you know, more than 14,000 workers have died during the pandemic who have contracted the disease in the workplace because their employers aren't controlling the risks to their health and their safety. And you know, we've got numerous examples of people that we all know that have been in that situation, and they shouldn't be. And if it wasn't for the sort of work that you've done, Tracy, in holding your employers to account, then there'd be a lot more. I mean, it's a sad reflection, isn't it, that we're saying that all those thousands of people have died. But it's absolutely imperative that we look at how we unite across the trade union movement, how we support each other, and how we get more workers involved in the trade union and saved, you know, in safer circumstances in the trade union. So our last speaker is Phil Taylor, and he's done some fantastic work during the pandemic with call centre workers, doing some research. I think what's really important is I think it showed how important it is to have that detailed analysis done, that detailed research done, because it allows us to be able to, you know, call out these bad employers, and it gives us the evidence to call them out. And I think that's, you know, the real value, I think, has come through the pandemic and the work that you've done, Phil. So over to you, Phil. You need to unmute yourself.
Okay, thanks very much for the invitation. And it's great to follow on from Lesley-Anne and Tracy, because, I mean, both of their contributions I thought were excellent and highlighted, you know, precisely the sorts of problems and the challenges we've got. Now, I want to start off with a simple question, I suppose, and that is that why a session on call centre matters, why a hazard session on call centre matters. And I'll start with another question, actually, which you can put your answers into the chat box on this one. And that is, how many call centre workers are there in the UK? Have a guess. Put it in the chat box. And the first prize will be a half bottle of Buckfast, and the second prize is going to be a packet of Haribos. Okay, both really good things to give out, I think, at a health and safety meeting. Anyway, the theme, of course, is stopping the abuse of call centre workers. I want to start with this kind of notion of abuse, really, because, I mean, abuse can be something that, you know, it can be workers' experience of a bad manager. It can be the bullying that you get of a manager. It could be the abuse that call centre workers, agents get from customers, possibly irate customers who may be frustrated for all good reasons in their lives, but actually do take it out on the workers. It can also be abuse in the sense of, let's say, I was speaking to Janet before about this, acoustic shock, problems with the headsets, bang, a real horrible, terrible, deafening problem that can be really damaging to people's hearing and so on. These are all forms of abuse, and there are many, many more of them. But in the short time I've got available, I'll come to some of these in a minute, but what I want to talk about really is something more systemic, really, about call centres that causes kind of more general abuse and so on, that brings this wider sense of abuse to many workers. And the starting point for this really is to understand where call centres actually came from. Why have we got so many people working in call centres? In a way, what call centres are a kind of emblematic of this stage of neoliberal capitalism, really. And they come from a situation in which companies, in order to maximize profits, drive down costs, have created this distinctive organizational forum which brings workers together in quite large clusters in workplaces. And for those of us who've got long enough memories, I'm afraid I've been studying call centres for 25 to 30 years. So, I mean, when I started researching call centres, I did actually have a full head of hair. But if you'll remember the telephone that bounced along, the direct line telephone, the direct line and First Direct revolutionised financial services. They were the two major instigators of call centres. And what they did was strip away the need to provide services on the high street. Okay, so these services were gathered together through economies of scale in fairly large workplaces. And once Direct Line and First Direct had done it, everybody in the financial services sector did it, telecommunications did it, holidays, the public sector and so on, and followed. And what call centres are about, I mean, Tracy picked up on this, mentioned this earlier on, that's what managers do. They come back to pushing back or trying to seek to gain ever greater kind of value or effort of workers. Why do they do this? Well, what call centres do is they bring together computer and IT technologies in really quite distinctive ways. And it's these technologies that pace, that monitor, that structure the calls, that measure to an infinitesimal degree the length and the duration of calls and so on. And the very first thing that Peter Bain and I wrote about call centres, we likened the call centre to being like an assembly line in the head. One call comes, another call comes. As soon as one call drops, another one comes through and so on. And what's built around this relentless, repetitive, standardized kind of labour process, if you like, is a whole architecture of targets, of average handling times, of call handling times, of waiting times, of wrap times, of not ready. This battery of quantitative measurements and so on, which people have said sometimes, encompass, don't they? Toilet breaks, timed toilet breaks. I mean, I have got an example of the Student Loans had a call centre in Glasgow where they would follow people into the toilets and time the toilet breaks, Is it a number one? Is it a number two? I always used to think that gave a different slant to the idea of time and motion studies. I apologise for that. But then call centres putting the emphasis is on quantitative throughput of calls. How many calls come through? How quickly? In BT a number of years ago, there was an estimate that if every single call had 1 second shaved off it, the company would save £10 million. You're dealing with that scale of calls, that's the compulsion to shave off call handling times and so on. But at the same time, workers in call centres face the emotional problems of having to relate to customers one after the other, performing emotional labour, the outcome of all of this leading to emotional strain, burnout, and so on. The fear of monitoring, the fact that your calls are recorded, the fact now, which I noticed the Teleperformance are well into, the technologies that emerge that can detect raised voices or in many ways can detect pitch, tone, empathy, understanding, bad words, and so on. Automated technologies that then increasingly can put workers under the spotlight and so on. So workers in call centres, by and large, have these twin pressures of having to display high levels of customer satisfaction and quality, but at the same time, this call throughput. And then on top of that, we get the structure of performance management that introduces other levels of uncertainty and insecurity into people's working lives. I've written tons of stuff on this. Now, is this true of all call centre workers? No. There are some decent ones. There are ones in which these are not necessarily priorities and so on, but they are for the majority. And the mass production call centre is a generic type that has generic psychosocial, mental ill health outcomes for very many workers. All of the studies I've done over 25 years would show that. However, as Lesley-Anne said, conditions are worse, pay is inferior, conditions are worse in outsourced, non-unionized call centres where the basic protections don't exist. And the whole reason for existence of outsourced call centres is to save the clients money through this outsourcing. The saving of the money then transfers on to workers who have to work harder and so on. Now, I'm conscious of the time, so I just want to finish on a couple of things, two themes, right? One is COVID. One is more generally health and safety. Now, the checklists that we've been talking about are really important, whether that's lighting, display screen equipment, appropriate desks. There are a lot of issues relating to the immediate working environment, the workstation, and the more general working environment. I think what COVID did, and it's been mentioned, that COVID exposed the real hazards that exist in call centres in quite dramatic fashion. This pathogen that we detected and understood early on was not simply about you get it through touching or 2 meters social distance. The aerosol transmission of COVID in indoor buildings, 70% of call centres or modern office buildings are sealed buildings. Absolutely, these are sealed buildings. And that means that the heating and ventilation system can circulate the bugs, the germs, the COVID round the workplace. Absolutely. Did we need COVID to tell us this? No, we did not, because we know from all of the studies that workers have said whenever anybody comes into the office with a cold or a blood, everybody gets it. I've got text, if I did a textual analysis of all of the comments I've got of workers working call centres, spreads like wildfire. It's like wildfire, etc., on and on. So you have the coming together in COVID, and this is the cost reduction thing in call centres. Workers cram together often in high density occupations to reduce building costs, right? 40% of call centre workers were working at the time of our survey within 2 meters of each other, which we know is not sufficient because aerosol plumes can travel tens of meters inside workplaces. The walking through the building by which workers could get contaminated, and so on. So you put these things together, the heating and ventilation system, the inadequate cleaning regimes, and the lack of social distancing, call centres become petri dishes, a recipe for disaster. And within that, the ventilation being a severe, serious problem. I have used the material that Hilda and Hazards have produced. In fact, we had a meeting, Lesley-Anne talked about this. We've got an in the Scottish Government where we've been lobbying like hell, and it made some difference. I mean, the last meeting we had, I just sent round the presentation that Hilda and Hazard had done on ventilation, and it's been picked up on. So chipping away at that level. So to finish, really, I suppose, dealing with the abuse of call centre workers, all of the checklists, the workstations, the ergonomics, the question of density, a far bigger challenge, I think, exists over heating and ventilation. We're going to have to get a head around this. How do we ensure? I mean, there's a bigger question, isn't there? What will be a safe return to work? The risk assessments, ensuring that health and safety reps understand what needs to be done. But you know what? Ultimately, in terms of what I mentioned about the call centre regime earlier on, I think the question of workload, targets, breaks, the fundamental nature of call centre work is something that we have to have in our mind to continue to challenge, right? 10 minutes breaking out would make a difference. It doesn't happen in call centres. Why? Because employers need to keep workers working maximum amounts of time. 98% occupancy rate of the workstations and so on. Dealing with the targets. Any reduction that we can get in targets. Dealing with or challenging forms of performance management that create the insecurity that the workers experience through unfulfilled targets, getting rid of performance improvement plans, PIPs, that do people's absolute heads in. And you know, I've come to the end here without even talking about all of the new challenges that are confronting us and trade unions and call centre workers, you know, in the working from home environment. I mean, Lesley-Anne really did touch upon them, and I think we can open this up, because I think when she talked about teleperformance, absolutely clear that teleperformance is a global leader in the standalone call center industry, is looking for a way to strip out all of the costs associated with buildings and create this virtual work where risk is placed ever more onto workers themselves. I mean, the other thing I will say is, just as a very positive thing in conclusion, I think there are good cases for showing that when unions do relate to what really matters to workers, not imagined agendas, but workers' real agendas, then it's possible to recruit, organise and move forward. And I think the end of the COVID period hasn't ended, but at least now there's the health and safety issues are uppermost in many workers' minds. This does give us an opportunity, I think.
Thank you so much,
Curran
Phil.
wins the Buckfast.
Does he? Oh, Mandy.
1.3 million.
Wow, brilliant.
She's also Scottish as well, so.
Thank you. Thanks so much, Phil. That was really interesting. And, you know, so it brought to mind, you know, when we've got this definition by the HSC that says that offices are relatively safe workplaces, and we don't inspect them, we don't look at the conditions that they're working in, those workers are working in. And I think what's been shown through the pandemic is that actually some of our offices are some of the worst working conditions and the most at risk during the pandemic, because they're not controlling the risks of diseases. They're not putting in place proper controls, and you know, people have become infected and have died as a result of that, direct result of that. So we've got a long way to go, really, to challenge and to give people the confidence to challenge what's going on as much as anything else. So I don't know for questions, really. Is anybody would like to ask a question? If you'd like to indicate, either put your hand up or put your electronic hand up. I'll take either. Yes, Julie. I'm sorry I had trouble getting in as well, Julie.
No, thanks for sorting it. Good evening, everyone. I work for an insurance company, and the point you were closing off there about the perceived risk for an office environment, Janet, and you touched upon it as well. Historically, we'd have been seen very much as low risk with the odd slips, trips and falls hazards, as opposed to the wider sectors of the trade union movement and the heavy industries. But for a long time, with the stress and the mental health sort of being the forefront within the office environment, I think COVID has brought a new lens as well in terms of the risk rating. So it's just to get your further thoughts, Phil, in terms of how we get that mentality with the health and safety management team within the industries, particularly finance and legal sector, that we are in a different world of risk, because ours is coming at the view of it's low risk, even with all those things you've commented about the ventilation and sealed buildings. So we're having a real struggle to get that sort of mentality before you make any progress on the actual mitigating actions. And I think Boris hasn't been very helpful with this idea that you wave a wand and it all goes away and then you're back to normality. And we're getting very much the vibe that this 21st of June date, although hopefully that seems to be getting pushed further and further back, that the distancing measures, etc., should just go away. And I'm trying to argue from a mental health point of view, if nothing else, if folk have been at home for such a long, protracted period, surely it will help the adjustment to get back into the workplace rather than be crowded in with immediate return. And I think the combination of that return to the office, and we're also going to have that mixture of home working, maybe not to the flexibility that individuals would want, but what the business believe they can accommodate. So rather than individual conversations, some parts of our business are saying 3 weeks of the month you can be in the office and a week at home, but we will tell you as a shift pattern which of those weeks it will be. So the individual nature and the flexibility is another concern. Thank you.
Thank you, Julie. I think you raised a number of really good points there. And then it's how we challenge, because we're talking in the hazards campaign all the time. We've got to keep in place all the controls of the risks, because those risks haven't changed. The risks that we're facing in our workplaces, which every workplace hasn't changed. So how do we put the pressure on employers to maintain that, despite what Boris Johnson says, and despite what anybody else, our employers, are saying? I'll just bring in Mark next, and then we'll go back to the speakers.
Hi, yeah, Mark Tripconey. I'm the Southwest Regional Health and Safety Coordinator for the CWU. And in my patch, I'm in the telecoms side. In my patch, I've got 3 call centres, which is probably, if you added them together, is about 15 to 1600 people. And again, listening to Phil and Lesley-Anne, it's really quite interesting, the concepts and the issues they've highlighted. And I like particularly Phil with the ventilation. I think the buildings that air call centres are all 20 years plus. So, it's been something that's been an issue going all the way along. And obviously this pandemic's highlighted the need to make sure we've got better suitable ventilation, and basically the kit's obsolete. Of course, I have the danger of raising too much of an issue and they close the centre and move people a long way away. It's a battle. It's trying to get that balance, but it doesn't mean that we don't treat people in a safe and healthy way. And the other, we've been lucky in EE and BT Consumer that we've, 60 to 70% of the people were enabled to work from home, which meant the sort of COVID ability to social distance and particularly prevent hot desking, and i.e. sharing keyboards, mouse and facilities, was something that we were able to address. But as both Lesley and all the speakers have raised, is yes, you've got people working from home, but there are a significant number that have struggled with working from home. They thought it was fine to work from an ironing board and a kitchen stool, which it wasn't. And we, over time, we have managed to address some of these things. But I think the mental health issue of people working from home and the isolation is something that needs to be addressed. And it's their workplace. We need to, deal with it as if we're going to go to a working from home model for a lot of office people, we need to ensure that that's a safe place for them to work. It becomes their workplace. It's not just their home. How we do that as trade unionists is a challenge. And I know in my own business, not just in call centres, with the open reach engineers who mostly start and park from home, speaking to them, reaching out to them and making sure they're safe has become a much more challenging thing. And as we move to that maybe more working environment, I asked the question, how are we actually going to keep in touch with all those people appropriately and making sure they're safe working from home? And as I give the example, a kitchen stool and an ironing board is your desk. I'm sure there are people out there still working in that way, and it's how we make sure those people are safe. Thank you.
Thank you, Mark. That's some really, really useful points that you've raised. It's interesting, isn't it? The hot desking issue came up early in the pandemic, and we thought that would be a reason why we didn't have to have hot desking anymore, because it was, because of the dangers of people using the same equipment and not being cleaned properly. And, and that was how we were thinking early on. But, you can just imagine how employers are going to, and how employers are reacting. And lots of them are thinking about cutting back on some of the office space and doing lots more hot desking in all sorts of different sectors. So, we're going to be facing increased challenges, I think. Lesley-Anne, do you want to come back on any of those issues before we ask anybody else?
I think some was addressed, the first question addressed to Phil, but I'll come back to Mark just briefly. I'm CWU account man as well, Mark. I can see that in your chat. Nice one, sir. I'm going to also mention a part of BT that you forgot about a minute at PlusNet, because they don't have union recognition at the moment. And when BT were you might recall at the beginning of the pandemic, well, BT Sport were still operating, and there was no sport, but they were still operating, and there was serious problems in there. But your fundamental question was how do we keep reaching people, and I think we have a problem in that people are getting a bit lax about their health and safety concerns. I like the fact that people are still wearing masks personally, because it keeps you conscious in many ways, even if people think they're unnecessary. It keeps you conscious of other parts of COVID safety. But yeah, I'm going to talk about our risk assessment checklist, which we're trying to supply simple tools, pocket-sized tools that keep the consciousness for people. And the more we can do that, the more they'll come back to us to build that relationship with call and contact centre workers. You with me? Does that make sense? Is that kind of? I know what you're saying. You know, as people, and people particularly when you're talking open reach as well, when they're back working in the field, they were in jeopardy at the beginning, because they were still getting asked to go into folks' houses, and that's at the beginning of COVID, there was all sorts of problems there for telecoms engineers. But I would say it's about awareness, and it's things like hazards can be really helpful, not just the unions themselves, but using other organisations that can relate to this, hazards, health and safety reps like yourselves being out there, and whatever tools we can provide that are convenient, attractive and easy to use for workers and members to engage with. And we just have to keep at it. Phil used the term chip away. And it's not just chipping away at the Scottish government. We just have to be chipping away at members and workers, and keep it in their minds. And eventually, for some of them, and I'll use a teleperformance example, the workers that we were working with, I didn't go into too much detail because teleperformance is not because I don't trust anyone in this call, but we're talking about 3 members who have only been union members for a matter of months. You're not talking about long-term members who joined CWU as it happens because of Call Centre Collective, and to have started on a journey now. It's great they've had their first big action. It's had a bit of a success, which is not always the case. But we're also dealing with workers who really are not confident, as Janet mentioned, but need the tools, need the confidence, and need the knowledge, and also need the longevity of our commitment to them as well. And sometimes I think because we're so flat out that we're not quite nailing that, but we just have to keep at it. I'm not sure that's a satisfactory answer, Mark. I hope it is.
Thank you, Lesley. I think that's you've made some really good points, I think, in answer to what Mark asked. Phil, do you want to come in?
Hi, Julie, pal. How you doing?
Fine, thank you.
Yeah, I mean, I'm assuming that you were working from home from relatively early on in your organisation. Is that correct?
Yeah, absolutely. The majority being at home. Some of the so-called key workers that needed access to certain files or systems, and by exception policy for domestic issues, health issues. So we're still limited numbers.
Right. I mean, because I'm just thinking back a year ago. I mean, I kind of most days I relive where we were a year ago, and I don't think that's a bad thing to do, by the way, because we remember what an absolute total cluster, fill in the missing word, was a year ago. And at the time that we did the first survey, I mean, absolutely, it was horrific. I mean, the questionnaire was going out, our questionnaire through the unions, including Unite, going out to workers, and I'd left my name and a phone number and email address on the front cover. I was getting 15 to 20 calls a day from people who were absolutely terrified, call centre workers terrified of what was happening to them in their own workplaces. The fact that they were still coming into work and were really facing a horrendous petri dish of, that's the best way to describe it. And somebody described it being like going into workplace was like, it was like, you know, it was really Russian roulette. If I don't get shot today, I'm going to get shot tomorrow. The survey revealed, I think in the survey that I did, there were reports of 12 deaths. So it's not just DVLA. I mean, there are 12 deaths. We know from the Tom Wall, the journalist, the Observer BBC journalist, 562 outbreaks was it? That's right, that's the figure. Since between September and December of last year amongst office workers. So your point about slips, trips and so on, oh, these are, and Janet's point, that these are safe workplaces. Absolutely not. COVID has exposed how terribly dangerous office workers are because of these variables. Now, I'm trying to respond to your question here. I think the prospect of a return to work gives us an opportunity because it concentrates the mind. Now, for you who've been out of the workplace, the prospect of going back to the workplace will cause fear amongst some workers who know that COVID hasn't completely disappeared. Good God, there's this new Indian variant, which they kept under wraps, by the way, because of the election last week. And the fact, notwithstanding the vaccination campaign, the fact that this exists. So it gives us the opportunity from a collective bargain in the health and safety point of view to have risk assessments, thorough risk assessments involving the workplace as much as possible, involving the reps and others into what would be safe for going back to work, right? And I think that will focus the questions. And, you can raise questions about, as Mark mentioned as well, about the heating and ventilation system. When were the filters cleaned? There is a checklist. Look at Hilda's checklist. There should be no recirculated air at all. There are minimum requirements of fresh air in the building. You can challenge occupancy rates. It's not a question of going back to what it was before. So I think all of these things gives us an opportunity. The other side of that is, Julie, I don't know if you saw my report on working from home. Did you get that, the final report of the working from home report? Yeah.
Yeah, I think I've seen that. Yeah.
Yeah. So in that report, for example, and this is where there is a possibility where we have trade union recognition and engagement, bargaining, and so on, or even consultation, to raise the question of workers' preference. Employers will want some kind of hybrid. In general, will want some kind of hybrid regime, in financial services. But it's a matter of, I think, on the basis of the evidence, putting forward what workers want to happen as well. So one size doesn't fit all. So at least rhetorically, we can go through this period by saying, look, this gives us an opportunity to maximise the interests of workers as aligned with what management want. I mean, there's been no evidence, I don't know, there's no evidence that working from home has led to declines in productivity. The contrary is the case, actually, where in the survey, 29% of workers said that they're working extra hours over and beyond their contracted hours. These are the sorts of areas in terms of working from home that we'll need to address and so on. Anytime you want, Julie, get in touch with us and we can have a longer chat about that. I'm more than happy to do so. I think in terms of Mark, I mean, I won't say too much here on this, but again, in terms of the working from home stuff and the fact that no one size fits all, that really fits. What do the workers want themselves? I mean, and approaching management and saying, look, the interests of your organisation rely in responding to how people best are likely to work in the future. What the working from home a survey shows us, and this is the mental health issue, it's no surprise, is it? What is the number one reason why people would want to go back to the workplace? To socialise with their mates. It's the thing that they miss most of all. That comes out absolutely clearly, number one. Number two is not having to pay money on transport to work and commuting, saving money and time in commuting. And then the number one disadvantage is this isolation, the mental health issues that come from being in the house and so on. And again, it's not one size fits all. I mean, I will have had hundreds of discussions with workers who say, working from home suits me. Maybe the demographic is somebody who's a wee bit older, right? A wee bit older. Maybe the kids have left home or what have you. They've got a room or a proper desk or what have you. They've got space. Now, that is very different from a single parent with two kids rattling around the house who are balancing a laptop on their knee on the edge of the bed. So all of these things that people have raised about what workers want to make themselves safe and what management have to provide to make themselves safe. You mentioned, I think it was Mark, yeah, the home is a workplace and therefore should be treated as a workplace with all the protections that come from the existing legislation and so on. I mean, one thing that might be useful for you to do, and I mean, it might be useful to do have a survey of the members in your branch, in the workplaces, a local one. What do you want? You know, okay, 5 days, assume a 5-day week. How many days do you want to be going back to work? What do you require most? Some evaluation of what the workstation is like at home, how comfortable is the chair, etc., etc. All of that. So using those checklists in a more structured way to give you the evidence to go to management. I mean, those are just kind of like some suggestions off the top of my head.
I think that's really useful, that, you know, and I think that's something that we do in the hazards movement all the time, isn't it? We're looking at mapping and we're looking at how we get the information off members. And I think that it's a good time to do it, you know, in view of what's happening. I think that'll would work really well. I think that'll be a great initiative that we can sort of promote to, you know, to get workers to get reps to start asking. And also it gives you contact with your members, doesn't it? It gives you contact, and it's another way of doing an inspection, you know, using an inspection checklist is how we get reps, you know, organising better, you know, and improving the way that in contact members. Tracy, do you want to add anything?
Well, yeah, I mean, just moving on from that, Jan, I mean, it's funny you should mention that, because I think one of the things that we've been grappling with, our health and safety reps have been, one of the most common themes this year has been, you know, the kind of battles with management that they've had to have just to get basic, you know, involvement in risk assessments and all of that sort of stuff. So I think that what's also been quite good at the same time, though, is that I think I think Julie made the point about before, you know, health and safety was more seen in the kind of blue collar industry, if you like, the more traditional sort of type, not necessarily in an office environment. And, you know, the pandemic's brought all that to the fore. But also as well, what we're doing is that we're picking up, we're revisiting, you know, the Health and Safety at Work Act, we're revisiting the management regulations. You know, we're relearning that, not relearning, but if you see what I mean, we're having good discussions about how we can, you know, obviously the legislate, we've seen that, you know, the legislation and the law doesn't, you know, just because you quote it, you know, the manager's not going to go okay then, you know. But, you know, we've got loads of examples about where that can be used effectively. And I think that there's an important role that, you know, that we can all play, the hazards campaign, the unions, you know, any call centre collective, is how do we support our reps, if you like, you know, to have that confidence again, because in many cases, you know, you're dealing with really hostile managements who are, you know, and particularly in a call centre environment, that they don't care about the health and safety, and perhaps sometimes don't even understand what health and safety is. I would just add a couple of things to what Phil was saying. I think that's right about the surveys, they're very useful. But I would also, you know, in terms of when we're talking about how alienated everyone feels, I think just to point out as well, there's going to be quite a significant challenge, if you like, about how the unions organise again in the future as well, because, you know, if we're moving to a kind of, you know, hybrid sort of, some, you know, more people working from home, then we're not going to have those traditional methods that we used to have in the workplace, where, you know, visibility, talking to people in the fag room, the smoke room, you know, about, you know, the coffee break, all those types of things. So I would also, in addition to that, one of the things I've been doing, and just my work colleagues, not PCS members I represent, is just making an effort and ringing round my colleagues, you know, because we've all, you know, we've all been working from home. You know, I'm lucky enough that I don't work in a call centre. I actually do a job I really feel passionate about, although I still have the, you know, problems around disconnecting sometimes and all that. But then, you know, sometimes you forget that your colleagues, you know, are kind of, you know, are also working on their own as well, and that can be quite empowering, just that act on itself, you know, just kind of, you know, even just ringing round fellow reps. I think that's why our health and safety rep regular discussion forums have also been quite useful as well. we kind of took a decision all throughout the year that we just held regular health and safety reps meetings, and I think those were invaluable in terms of, you know, grappling with a lot of the issues that many health and safety reps are facing on the ground. We've had a lot of discussions about the issues around mental health and stress and burnout, and in the civil service they're very conscious that they've got a workforce that's heading towards burnout. We do actually have some managers who say that they, you know, that they want to do something about it, that they've got sympathies with what, you know, the union's saying in terms of, you know, well, why don't you pay staff a decent wage? Why don't you put more resources in? You know, why don't you address the underlying issues and the policies that you've got in place, and toxic workplaces and all those sorts of things, you know, that we're all having to deal with. I think that having a network of like-minded people who are, you know, can bring so much sort of value to your role as a health and safety rep. And remember as well, you know, it's really good that, you know, the movement's actually been kind of pushing on the issue of ventilation as well, because it's something that employers and government have deliberately suppressed for political reasons, in my view, because you know, it's been easier to punt the narrative that it's all the fault of individuals rather than employers. Interesting, obviously, that no employer's been prosecuted throughout all of this, but I think that you know, the unions nonetheless have pushed it. It's now widely recognised. I would just say that don't think that you have to be an expert on it, would be my advice. We produced some quite kind of as well as the slides that the Hazards campaign produced. We also did a little kind of, you know, how to just deal with it on a workplace. We just did a little simple checklist of what the types of things that you should be asking management for. And the key issue is, you know, fresh air, ventilation. There's a very good app. I can't remember what it's called, but I can find it and send it in the chat box. Basically, you put in how many people work there, the size of building, what type of HVAC system it is, and the type of activity that people are doing, so talking, singing, whatever, and that calculates for you when it becomes a risk based on airborne transmission. So I'll stick that in the link as well. But just to say that I think that, you know, as Lesley-Anne said, you know, we keep building the movement, don't we? You know, and we take strength from each other, and you know, whatever we can do to sort of build that strength and collectivising the issues in the workplace, all the better. So I'll stop there. Sorry.
And thanks, Tracy. I think that's some really useful information and suggestions that you've put in place, you've raised there. And I think that one of the issues about working from home is this how do you ever disconnect from work? You know, before the pandemic, we saw that France passed a law to say that you could switch your phones off, your mobile phones, so you weren't on call all the time, like, you know. But actually, you know, during the pandemic, lots of us have been working from home. We've been on call 24 hours, and our employers are expecting that, and that cuts across all different sectors. You know, doing the work with the universities, they're getting calls and emails coming through from students at all times of the day and night, and are expected to respond, and you know, and also their workload and you know, and lots of issues that they're experiencing. But it's you know, these are the issues that we're experiencing in all our workplaces. Mick Holder had said maybe we should be raising the possibility of a TUC Union Lane running a course on working from home, and I think that's whether it's the Union Lane, because I think they've stopped now, but whether that's the health and safety at TUC, I think it would be useful to explore, because there's a lot more issues now, I think, that we need to that have been raised tonight, and certainly that we need to be looking at. Hilda's raised a few things in the chat about the ergonomics about working from home, you know, and the importance of equipment and how that impacts on our health. I think she's gone now, but I was going to get her to come in. But, you know, if you go onto the Greater Manchester Hazards website, we've done the fact sheet. Hilda's done the fact sheet on the sorts of things that you should be doing. We also did a podcast sort of thing from one of these sessions, and it's on the Hazards campaign website, which is quite useful. you know, looking at all the way that we should be looking at things in our homes, when we haven't got the experts, the proper experts doing those risk assessments. But now, 14 months into a pandemic, we should all have, if anybody's working from home, we should be having proper risk assessments done, you know, the DSE checks done. It should have been done ages ago, but they should be done now, and proper equipment provided by the employers. There's a couple of things that I just wanted to raise, and you know, anybody else wants to ask a question, then certainly put your hands up or let me know. I'd like to know, I suppose, what we can do differently in Scotland, and can we use Scottish government to put more pressure on the HSC or on you know, in the UK government to try and ensure the health and safety in places like call centres. There's something more that we can be doing by using sort of any way that we can improve working conditions, improve health and safety of workers. Or, you know, is Scotland being any better? You know, and I know you've had the FAS committee, which has been, you know, something where you can sit down with trade unions and HSC and other health organisations. But do you think that's been any better? Do you think that's helped? I mean, I'm not sure that the outcomes have been much better in Scotland than they have been in England and Wales. And certainly in Northern Ireland, you know, there's certainly still situations, still differences there. I mean, I was speaking to some bus drivers a couple of weeks ago in Northern Ireland, where you would think that with better health and safety, there could be better health and safety, and still, you know, they're being told they can't wear face masks. They've got to take money over the, you know, the front of the bus. You know, so they're not controlling it, and even though that they're at the beginning of the pandemic, wrote out to all, did a press release to say, come and tell us if your employers are not controlling the risks. You know, so what is there? Is there some leverage that we can put in place, again, you know, in different parts of the UK that would help us as trade unions, as workers? Mandy, you want to ask a question?
Yeah, I just wanted to ask, obviously I come from a civil service. It's not a contact centre or a call centre, but well, kind of half and half contact centre, processing centre. But it's a very similar setup. But obviously we have a slightly better pool when it comes to things like getting furniture from working from home and having the right setup at home. But surely that under the disability law and the equality laws and things like that, there must be something in place where if you have a disabled worker, you have to provide the correct kind of furniture and things like that in the workplace. And obviously if you're working from home, that has to be then replicated when working from home. So obviously there must be some sort of standard in the call centres where surely could that not be expanded on because the working environment has changed, and you could have people that maybe didn't have a disability a year ago in the workplace, but because of the way they've been working now, they've actually ended up with something wrong because of the way they've been working without the right equipment, and surely under the employer's duty of care to their well-being and I can't even say the word, but you know the word I'm going to say. This I can never say it. They have a responsibility to make sure that they're not damaging their staff, basically, and surely there has to be something more that can be done to kind of push that under the health and safety laws that are there and in place already.
Yeah, so they've got a duty of care whether you're working at home or you're working in the workplace. Yeah. You know, and that has to be put in place, and reasonable adjustments is part of that. You know, that it doesn't matter where people are working. So yeah, we've got to find a way of enforcing that is the issue. Cathy, you wanted to ask a question. Hiya.
Not so much a question, it was to respond to what you were asking about Scotland and, you know, England and Northern Ireland and so. I mean, I find it really difficult to know how much better things are in Scotland because I'm in Scotland and not anywhere else, and people might have a better take. I think my sense is that we have a bit more of a direct line to raise things with the Scottish government. That's not saying a lot, but I think it, you know, we are, Scottish Hazards is and the STUC are both on the COVID Safer Workplaces group meets every 2 weeks with Scottish Government, with the HSE, with business, that's partly through FAS, as you were saying, the Partnership on Health and Safety in Scotland. And, I wouldn't want to over-egg what that means, but it does mean that when we get cases and issues brought to us, we can take them straight there and have them discussed by all those people. And I think sometimes it does create some change in what's happening. I wouldn't want to put it too strongly, but I think what we're hoping is that ability to have a fairly direct line won't go away after, well, wins after COVID, maybe never, as things go back to the way they maybe were. So the other thing I just thought I'd say really briefly in relation to what Mandy was saying was we've been doing some training with health and safety reps together with the STUC. And one of the suggestions that was talked about quite a lot in terms of working at home was trying to argue, and I don't know what people think about this, but trying to argue for organizations to appoint almost like an old welfare officer or something, but somebody whose responsibility it was to link with people who are working at home, both in terms of physical ergonomics, etc., but also in terms of lone working, domestic, all the things. So it was just an interesting suggestion.
Yeah, thanks, Kathy. That is interesting. Phil, you wanted to come back?
Yeah, it's just to add to what Kathy said. I think that's right, what she says about, we shouldn't exaggerate it, but there's a direct line as an influence. I mean, I've been involved in the call centre. Well, it's like drawing up the guidelines, the call centre working group, Scottish Government set up a working group. And, there's no question that myself and Pauline Rourke from the CWU, who's on the call centre collective as well, we've been able to make an impact, that's for sure. I mean, about a year ago, I was really full on about aerosol transmission and, was getting complete deaf ears all round. Obviously that's been conceded, if you like, but there are other things that they've shifted on. I mean, a year ago as well, I was banging on about hot desking and we pushed them a little bit, but I reckon by the time we've reconvened, and we reconvened because of a petition that we circulated through, it's true to say, Lesley-Anne, isn't it? A petition that the call centre collective organised, requesting the reconvening to deal with the new variants of the disease, the need for new risk assessments and so on, all of the second spike earlier in the third, second or third spike and so on. And I think over the course of a year, we certainly have shifted them. So there's been concessions on hot desking. I raised a year ago, I said, in indoor environments, if people are walking through buildings, they should be wearing face coverings. Poo-pooed. Won it. We won the... So in other words, on issues formally, in terms of guidelines, we've won a hell of a lot. But of course, to make that real then depends upon reps being able to take it up. Oh, the other thing that we won, of course, as well, Kathy, is the right for roving reps as well. That's something else, and that is not insignificant. So in answer to your question, Janet, you could certainly have a look. It might be useful for Hazards to see this anyway, to see what will be the final draft of the document. We see it as an organic process to give you a final draft of the document and the stuff that we managed to get, the clauses that we managed to get inserted, which make the Scottish guidelines really quite different from the HSE guidelines for the UK, or the UK government guidelines on call centres and offices. So in a way, what we've got is marginally better, good practice and guidelines, I would say, is probably the best place to say it. But hey ho, something that's better is better than something that's worse, if you know what I mean. So there's that. I think the second thing just that's probably worth saying is that, yeah, we've established, I think Kathy's right there, we've established a whatever fucking post-COVID is, a coming out of COVID thing, where, I mean, I made a point where I sent to the Employment Minister Hepburn, before we finished, a copy of the Working from Home report and saying, will this committee have the responsibility to deal with the home as a workplace in the future, etc., etc., putting them on the spot with this, and effectively they've accepted that. So they've taken on board. So I think we've got an opportunity to make sure that the working from home stuff can be coped with. So, I mean, there's plenty of things that are up for grabs, and we have to keep pushing on them. You can use the precedents. I don't know. We've got obviously a completely recalcitrant government in Westminster. Maybe one of the other routes is through the local authorities and the HSE, but the HSE were mute during during this working group. They didn't say anything. They didn't contribute. You know, I mean, when we had hostility from the employers, it was me and Pauline that dealt with it. HSE said absolutely nothing. There was no point in having them there, to be perfectly honest with you. You would have expected, even with the constraints, a little bit more. Anyway, I've rambled on too far. I think what we've got to repeat a point I made earlier on. I think the forthcoming period gives us an opportunity. We're all feeling a bit fatigued because we've come and gone through it, and then the vaccinations are beginning to happen, and we get some kind of sense of it being not as bad as it was. I'm not convinced about that, actually. I mean, well, clearly the vaccination and the older population and so on, who knows what these variants are going to cause? And we don't know what new pathogens or zoonotic pathogens are out there and can kick in. But I think what might focus our mind and give us a clear focus as a health and safety community is to say, okay, a change is coming. The change is going to be, one, a return to work for some, for many. Two, it's going to be a continuation of working from home. That gives us an opportunity, I think, to go to people, to communicate as much with the punters, to get drafts, checklists, guidelines drawn up, to revisit risk assessments and so on. And for us to take this as a really kind of serious focal moment. And in a way, I suppose we're a wee bit lucky because we got about 6 or 7 weeks, you know, to do that, 6 weeks to kind of prepare the ground, or at least to give ourselves a bit of a focus. I'm just kind of thinking a little bit, well, it's kind of halfway between a tactic and a strategy, I suppose.
Yeah, thanks, Phil. And I think it gives us lots to think about and lots to work on. Andrea, you wanted to just ask a question?
Oh, well, I was just going to make a comment, really. Is that okay?
Yeah.
I was just sort of thinking about, you know, what Lesley-Anne had said about, you know, trying to organise groups of, you know, young, unorganised workers. And I was thinking one of the things I think maybe we could do more of is just sort of, I suppose, shouting more about union wins and how, you know, it doesn't have to be like this, and saying a bit more about, you know, how union workplaces are healthier and safer. And so, for example, I've just been working on an LRD booklet on COVID and mental health. And one of the examples that a UCU rep sent, so you know, I can't remember how many LRD workplace contacts there are, but there's a lot. But kind of just trying to get information from reps is always hard. But you know, one of the universities has got basically like a do what you can policy in recognition that, you know, you can't do everything. You know, you can't kind of, you know, look after toddlers and homeschool and do all your work sort of thing. And just that, so I suppose it would be good to see unions shouting more about how it's better to be in a unionised workplace, and how actually you don't have to put up with the, you know, these terrible working conditions where you've got to, you know, put your hand up to ask to go to the toilet. And, you know, because in a unionised workplace, you can fight that sort of horrendous management practice. Yeah, and I just find it's really hard to find those examples, and that they kind of should be a bit more upfront, and, you know, people see the, you know, some tangible benefits about being in a union, I suppose.
Thanks, Andrea. I think that's some useful points there. And especially, I think the one thing we haven't talked about is young people. and the need to organise young people, and and lots of workers in these call centres and casual contracts are young people that have no experience of trade unions, and the need for to give them the confidence to challenge what their employers are doing, but also to get organised, I think is absolutely essential. Tracy, would you like to come back on anything before we finish?
But I think Lesley-Anne has got her hand up. I mean, I just wanted to agree with everything that's said, and I'll have to get Andrea along to one of our PCS safety reps meetings as well, and to promote the LRD. But I'll contact you outside of this for that. But I just wanted to say I agree with everything that's said, and I think that Phil's right that we are going into a period of great opportunities, if you like, but many challenges, and we've kind of spoke about them, about how we're going to maintain sort of supporting members when we're all various different working from home and all of that sort of thing, but popularising the idea that before the pandemic, if you asked to work from home, you were viewed with suspicion, weren't you? Oh, you must be at it, or blah 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 blah. Of course, now all that's been proven wrong. So what we've got to ensure as well is to make sure that we remember that fact, and that in any decisions that are going to be made going forward about our future working patterns, whether we're working from home or working in the office, it's done around our needs, and not around the needs of the business. But there's also a role for the unions to play and union reps to play, in terms of ensuring that we're staying connected with members as well, which is going to be really important. But it's a good period because as we've everyone's fed up with the nonsense, so potentially it's our time. So yeah, I'll just leave it there. It's been a good meeting. Thanks, Janet.
Thanks, Tracy. Lesley-Anne.
Yeah, just to say I agree, Andrea. I think it's been a criticism, a regular criticism labelled at trade unions generally about wins. For me, in the context that we're working in Call Centre Collective, it's about the campaign, it's about campaigning for those wins. And in relation to some of the stuff that's in the chats, I think that the idea of working from home training is a really good idea. There are issues about working from home, and we need to think about how we organise for working from home, a completely whole different set. And I think we also need to consider the fact that employers are moving right now, teleperformance being an example, to capitalise on COVID and move their workers into locations that are home and simply only outside. They're not outside a site, so the only communication they'll have will be online. It'll be closed, and it'll be even harder to access them. They're capitalising on that. So I think we need to move quickly to capitalise on what the advantages are, and maybe even be more proactive, not react to the employers, but be proactive about workers getting the best out of working from home. There has been some things throughout the past year, not for everyone, that have been advantageous, a slowing down of some of the rat race for some people, spending a bit of time where, not for all of us, I grant you, with family, and we're working from home. The balance between the two can be really helpful. So it's getting the best for workers, what they want out of this, the level of consultation that's required. And there's been talk for about, we've all heard it for a year, about the new normal, but maybe I'm not saying maybe it is, it's up to the labour movement to define what that new workplace normal looks like, what that looks like. It's up to us to define that. So, we can talk about these things, but being proactive about it. And I know we reacted to teleperformance because there just seems to be just a raft of employers doing crap things, and excuse my language, it's like crap things to workers, and it keeps happening all the time. But if we set a proactive agenda out there that we can work together with, and I suppose that's what Call Centre Collective is about. We have absolutely, it's only verbal, but utter integrity in federal agreement with the SDUC. Anybody that comes to us through Call Centre Collective will be directed to the appropriate union. We are not interested in poaching members. It's all about getting workers organised in these contact centres, furthering the movement, making sure their health and safety and other issues are sorted, and ultimately the public being safer as well. You know, it's a massive situation, but yeah, I think we need to affect the new workplace normal. So anyway, sorry, a bit of a rant there. Apologies.
Thanks, Lesley-Anne.
Can't help myself. It's Scottish.
Inspired rant. You know, I think that was excellent. So, you know, hopefully you've got something out of tonight. You know, I think some of the things that have been mentioned about sharing good practices, about you can leverage how we can look at leverage to increase and improve people's health and safety. The issue about mental health is going to be a massive issue in our workplaces, and we need to be able to look at how we're addressing that properly. You know, about prevention rather than about the sticking plaster, the mental health first aiders. You know, what are we doing to put pressure on employers to do something more on that? Using a survey to ask our members what's going, you know, what they want. Using the checklists that have been mentioned before, I think that's an excellent idea. You know, and it's something that about giving information to workers that they then can. It gives them the confidence to raise and challenge and to use in their workplaces. Challenge that notion that, you know, that offices are low risk workplaces. I think now more than any other time, you know, that in certain circumstances we're all in high risk workplaces, and that needs to be. We need to put the pressure on our employers to make sure they're controlling all the risks. We need to look at young and unorganised workers, how we can tell them about trade unions, how we can shout about trade unions, how we can make sure that we're leading by showing how positive, how important trade unions are. You know, showing by showing rather than about just talking about it. We need to be sharing those wins, sharing those good practice. And I'm absolutely inspired by the call centre collective, your campaigning, your ethos. I think that is the sort of notion, that's the sort of organisation that we want to be promoting, that we want to be part of, that we want to tell people that are not in trade unions, you need to be in organising because of that, you know, that this is how you can make a difference. And just finally, just to thank very much the speakers tonight for, you know, your inspired contribution, and also for everybody that's attended, and I'm sure the people watching it later will also appreciate everything that you said. So thank you very much, and we'll see you all in the next one.
Thanks, everyone. Bye-bye.
Cheers all.
Thank you. Thanks, Janet.
Thank you. Bye.
Night, everyone.
Cheers. Thank you.
Thanks, everybody.